Vitamins are often seen as the superheroes of health. Walk down any pharmacy aisle and you'll see shelves lined with colorful bottles promising stronger bones, better immunity, glowing skin, and more energy. For many people, especially older adults, taking daily supplements is as routine as brushing their teeth. But here's the part most people never hear. Taking vitamins, especially in high doses or without medical supervision, can actually increase your risk of stroke, brain bleeds, nerve damage, and long-term health complications. So why are we not talking about this more? Dr. Barry Scott, a seasoned brain doctor who spent over 25 years treating neurological disorders, began noticing a pattern. Patients coming in with cognitive issues, unexplained nerve problems, and in some cases, even mini-strokes, were often taking hefty doses of over-the-counter supplements. In one of his most alarming cases, an older patient, let's call him John, suffered a minor stroke despite having no major risk factors like smoking or diabetes. The only clue? He was taking 3 different vitamin supplements every day, all of which were way above the recommended daily intake. That led Dr. Scott to dig deeper into how common supplements might be affecting brain and vascular health. It's hard to imagine something as universally praised as vitamin D could pose a threat. After all, we've been told to get some sun for our bones, immune system, even our mood. And yes, vitamin D is essential. It helps your body absorb calcium, supports brain function, and plays a role in keeping inflammation in check. But here's what's rarely discussed. Once vitamin D is converted in your body, it doesn't leave easily. It accumulates, and in high enough amounts, it can turn from helpful to harmful. Dr. Scott began to notice a troubling trend among his older patients. Many were supplementing with vitamin D in doses that far exceeded the recommended daily intake, some unknowingly taking 10,000 to even 20,000 IU per day after reading wellness blogs or watching YouTube videos promising immune superpowers. One patient, Eleanor, a 74-year-old woman who prided herself on staying active and informed, came in complaining of fatigue, muscle pain, and a strange fogginess. Initial tests showed elevated blood calcium levels, a red flag. When Dr. Scott ordered a vascular scan, he found early signs of arterial calcification, essentially hardened blood vessels. The culprit? A combination of calcium supplements and excessive vitamin D, which was forcing her body to absorb more calcium than it could handle. The excess calcium wasn't going to her bones. It was going to her arteries. This isn't just anecdotal. Clinical studies have confirmed that too much vitamin D, especially in supplement form, can lead to hypocalcemia, a condition that doesn't just cause kidney stones or stomach issues, but can severely damage blood vessels and raise the risk of cardiovascular events, including strokes. The irony? Many of these patients didn't even need the supplements. A few minutes of sun exposure several times a week, along with a diet that includes fish, eggs, and fortified foods, would have maintained their vitamin D at safe levels. So why the oversupplementation? Dr. Scott believes it comes down to a dangerous mix of marketing, misinformation, and fear. After the pandemic, vitamin D was widely promoted for immune health, which is valid in the right context. But fear-driven health habits tend to lead to excess, and excess, especially in fat-soluble vitamins like D, comes with a heavy cost. In Eleanor's case, it took nearly a year to reverse the calcium buildup and stabilize her vitamin levels. She's doing better now, but she no longer takes supplements without a blood test and a second opinion. This story underscores a key theme of Dr. Scott's philosophy. Even the right nutrient at the wrong dose becomes a toxin. It's not about fear, it's about respect. Respect for how powerful these compounds really are, and respect for the body's limits. Vitamin E is often praised as the anti-aging nutrient. You'll find it in face creams, fortified cereals, and high-potency capsules labeled with promises of heart protection and immune support. And yes, in moderation, vitamin E can help neutralize harmful free radicals, reducing oxidative stress in the body. That's a good thing. But here's what most people don't realize. At higher doses, vitamin E doesn't just act like an antioxidant, it behaves like a blood thinner. Now imagine this. An elderly man named Frank, age 75, starts taking 1000 IU of vitamin E daily. He read online that it would protect his heart. He's also on low-dose aspirin for a previous mini-stroke, nothing unusual for someone his age. But the combination slowly begins altering his blood's ability to clot. Weeks pass. Then, after a mild bump to his head while gardening, Frank wakes up with severe confusion and trouble speaking. His family rushes him to the hospital. He's had a brain bleed. Not from trauma. From overly thin blood. According to research from the American Heart Association, doses above 400 IU of vitamin E per day have been linked to an increased risk of hemorrhagic stroke, the kind caused by bleeding in the brain. That risk doubles if the person is also taking anticoagulant medications. What's worse, there's no early warning sign. You don't feel your blood getting thinner. You don't feel the fragile vessels inside your brain becoming more vulnerable. And most people don't even realize vitamin E is doing more than just supporting their immune system. Dr. Scott explains that in cases like Frank's, vitamin E isn't the villain, but it's being misused. In nature, you get it through foods like almonds, sunflower seeds, and spinach, where it exists in balance, alongside other nutrients that modulate its effects. The problem arises when people isolate one compound and take it at pharmacological doses, thinking more equals better. But in medicine and nutrition, more can often mean more risk. Most people associate vitamin B6 with energy and brain function, and rightly so. It plays a crucial role in creating neurotransmitters like serotonin and dopamine, which affect mood, memory, and sleep. It also helps regulate homocysteine, an amino acid linked to heart disease when elevated. In the right amount, B6 is a nutritional powerhouse. But here's what gets overlooked. Vitamin B6 is water-soluble, yes, but it doesn't just exit the body harmlessly when overconsumed. Unlike other B vitamins, high doses of B6 are actually neurotoxic. Meaning, they can damage your nervous system over time. Dr. Scott explains that the danger with B6 isn't immediate, it's cumulative. And that's what makes it so sneaky. The body doesn't store it in the way it does with fat-soluble vitamins like A or D, but repeated exposure to high amounts can still lead to nerve inflammation and degradation. He shared the case of Janice, a 66-year-old schoolteacher who came in with strange symptoms: numb fingertips, tingling in her legs, and trouble with fine motor tasks like buttoning a shirt. She was terrified it was early Parkinson's. But after a full neurological workup, Dr. Scott found the culprit: vitamin B6 toxicity. She'd been taking multiple supplements daily, a multivitamin, a B-complex, and an energy booster gummy, each with overlapping doses of B6. Altogether, she was getting over 400 milligrams a day, 4 times the recommended safe limit. The symptoms weren't imaginary, and they weren't reversible either. Even months after stopping the supplements, Janice still had lingering nerve damage. That's because high B6 intake damages the dorsal root ganglia, clusters of nerve cells responsible for transmitting sensation from the body to the brain. What's even more concerning is how many people are unknowingly overdoing it. Many B6 supplements are marketed as natural mood stabilizers or energy enhancers, especially toward women and older adults trying to combat fatigue or brain fog. But unlike prescription drugs, these supplements aren't always required to show proven benefit, or warn about overdose risks. Dr. Scott emphasizes this: if you're taking more than 100 milligrams of B6 per day consistently, and you're starting to feel off, numbness, burning, pins and needles in your hands or feet, it's time to stop and talk to a healthcare professional. Because nerve damage from B6 doesn't come with a flashing warning sign. It starts quietly. And by the time it's noticed, the damage may already be done. Unlike water-soluble vitamins like C or B-complex, which your body can flush out daily, vitamin A belongs to the fat-soluble group. This means it gets stored in your liver, in fat tissue, and over time, those storage levels can quietly grow to toxic amounts without you even noticing. And that's where the problem begins. Most people associate vitamin A with better vision and healthier skin, and it's true, in the right amounts, it's essential. But when taken in excess, especially from supplements or synthetic sources like retinol, it can lead to a condition known as hypervitaminosis A. That's just a medical way of saying, your body has more vitamin A than it knows what to do with, and now it's causing damage. Dr. Scott tells the story of Esther, a 69-year-old grandmother who started taking a high-dose multivitamin marketed for healthy aging. It contained 10,000 IU of vitamin A, double the recommended daily allowance for adults. She felt fine for months, until she started experiencing persistent fatigue, dry skin, and strange episodes of dizziness. A routine checkup revealed elevated liver enzymes, brittle bones on a DEXA scan, and a diagnosis that took her by surprise: vitamin A toxicity. The liver, being the main storage center for this vitamin, is often the first organ to suffer. And in older adults, the liver's ability to metabolize excess nutrients naturally declines, making them even more vulnerable to buildup. But the risks don't stop at liver damage. Too much vitamin A can actually contribute to osteoporosis, the very thing many older adults are trying to avoid by taking supplements in the first place. It does this by interfering with the balance of bone-forming and bone-resorbing cells, weakening the skeletal system over time. And here's the catch: you don't need to overdose overnight to see harm. Chronic intake of even slightly elevated levels, say, 3,000 to 5,000 IU daily over months or years, can silently chip away at your health. You might chalk it up to normal aging, but in reality, it could be the vitamins you're taking to prevent aging that are accelerating decline. So where should you be getting vitamin A? The safest source is food, especially colorful fruits and vegetables rich in beta-carotene, like carrots, sweet potatoes, and spinach. Beta-carotene is a precursor to vitamin A, and your body only converts what it actually needs. That means no risk of overload. Coming up next, we'll take a closer look at niacin, another common vitamin that can turn from helpful to harmful when taken in high doses, especially for those trying to manage cholesterol levels on their own. Niacin is often used to manage cholesterol levels. In small amounts, it helps convert food into energy. But in large doses, especially over 500 milligrams per day, it can cause serious side effects: liver damage, stomach ulcers, skin flushing, and dangerously low blood pressure. Dr. Scott recalls a case where a 67-year-old man doubled his niacin dosage after reading a blog that claimed it could detox the body. A week later, he fainted in his kitchen and was rushed to the ER. His blood pressure had crashed due to niacin overdose. He was lucky, but not everyone is. Ironically, studies now show that high-dose niacin doesn't even improve heart health outcomes in most patients. So the risks often outweigh the benefits. Dr. Scott isn't against vitamins. He prescribes them when there's a clear deficiency. But he strongly believes that supplements should be treated like medicine, something you take under a doctor's supervision, not something you pick up casually at the store. In fact, he says the vast majority of people can meet their nutritional needs through food. Whole foods contain not just vitamins, but fiber, antioxidants, minerals, and enzymes that work together in ways that pills simply can't replicate. A salad with spinach, avocado, and nuts delivers vitamins A, E, K, magnesium, and healthy fats, without the risk of overdose. He urges his patients to focus on balance, eat a variety of colorful vegetables, lean proteins, and healthy carbs. Get some sun. Move your body. And use blood tests, not guesswork, to guide your supplement choices. Vitamins aren't inherently dangerous. But like any powerful tool, they require knowledge and caution. If you're over 60, or managing chronic health issues, ask your doctor for a nutritional review. Bring in your supplements. Get your blood levels checked. Because what helps one person could harm another. And most importantly, don't assume that natural means safe. Snake venom is natural, too. If you found this video helpful or know someone who takes daily supplements, share it with them. It might help them avoid a serious health scare. Make sure to subscribe for more eye-opening health content backed by real science and real doctors. And if you're looking for more ways to stay sharp as you age, check out our other videos linked in the description. Thanks for watching. Your brain will thank you too.